Many patients have got friends and relatives who take warfarin, and they're aware that you have to have blood tests, and they're aware that sometimes the amount of warfarin you need can vary, and people find it sometimes a bit of a nuisance in terms of therapy, but it's still worthwhile for many people, and it's still the first line for many patients with the aim of preventing strokes. There are some newer treatments available, and there's two I'd like to mention now. One of them is something called the new oral anticoagulation drugs, and these are drugs that act like warfarin, but you don't need any blood tests to monitor it, so it's a fixed dose that the patient gets, and there are some advantages with these. But there are also some patients who, for other reasons, they can't take drugs to thin the blood. So an example might be if you've had a brain hemorrhage, or if you've got recurrent bleeding in the gut, you can't be maintained on drugs that thin the blood, because all drugs that thin the blood make it more likely that you'll have bleeding episodes. And for those patients, there's a newer treatment called left atrial appendage occlusion. So I've mentioned before that in atrial fibrillation, there's a little pocket of one of the top chambers of the heart, and that's where the blood clot forms. But there's a procedure I perform called left atrial appendage occlusion, and this is where a little plug can be put into that pocket, and it means the patient doesn't need to be anticoagulated. So there's an alternative to many decades of anticoagulation for suitable patients. It's not a treatment that's available or suitable for everybody, and it needs a very careful discussion, but for most people with atrial fibrillation we would recommend that they're on warfarin or one of the newer drugs. But in patients who can't be maintained on those drugs, who are at risk of a stroke, there is this procedure, a one-off procedure, and it's something that's likely to develop and be more commonly performed over the next few years.